Have you ever wondered how you can unlock new opportunities and knowledge that can truly change your journey as an African immigrant? Then, you're in the right place. Welcome to the AIM Expert series, where we bring you insightful sessions, packed with practical strategies from top experts on topics that matter most to you. So, if you're looking to grow your career or understand the US system, then grab a chair and don't go anywhere. Now, let's get started on today's session.
There's a lot of things happening around immigration law, and that affects people directly and indirectly also, because either we've been there, we know people who are there right now, or we can, we're thankful, that we're not threatened as other people might be, but then we know that it's real, and those news affect us. And just violence in general, seeing those things happening, whether it's close by in our communities or even hearing about things happening on the national, international level, and all of that. Then all those things create a general sense of fear, of unsafety, and also disasters. Those are things that they don't happen enough. Not that they don't happen enough, but they don't happen often. But when those things happen, they are devastating. So even when we think about COVID, even if some people didn't get sick, I really believe that at some point we will find out all the different effects of COVID. And a lot of people who were in a time of transition during COVID may feel like they're still stuck there because those things impacted us internally. So just general pain, because all these things that I mentioned previously come with some level of pain, some level of fear, uncertainty. So those things create that stress, right? Then physical injury or illness is a big one also. It's kind of like the chicken or the egg. Like when you're sick, of course, your mental health also suffers because you are not in control of your body anymore. There's something wrong. Something is amiss and you're trying to figure out what's happening to you. And just, injuries, I've seen and heard injuries terminating people's livelihood, right? People's sense of purpose and things like that. And that goes back to what we talked about, challenging your identity, right? If someone's identity was wrapped up in being able to use a certain skill well and all of that, you can only imagine what that looks like if that is challenged. Okay, so I wanted to pause here really quickly and just get a pulse of the room. Is there any questions so far? Anyone can unmute and let me know.
I have a Randy has a question.
Yes.
Hi, so thanks for sharing the knowledge. So question, does grief look like the same for people? So say you lost your grandma, but somebody else lost their friend, and then they expect you to act how they act.
Oh, definitely not, because grief is a personal feeling, a personal emotion, and everyone will respond to it differently. And it really depends on the relationship with the person or the object. It's not even about just the name or the title that the person holds, right? But if based on the relationship, this person was a primary relationship in the person's life, right? If this was the first person with whom the person felt seen, heard, understood, it can be even more devastating than, it being a family member. And everyone will respond differently. I think we'll go to that next, because those potential causes often create a response. And the response is what we start seeing as symptoms that are mental health issues. So that's a good segue to go to the next slide. All right. So based on, did I answer the question? Yes, you did. Thank you. Okay, great. So, how we respond, right? How are we responding to the adversity? How are we responding to the disasters, to the pain, to the fear, right? That is what we start seeing as symptoms later that represent what professional counselors, psychologists, psychiatrists will determine as a diagnosis of, all these different diagnoses that we will talk about a little bit later. So let's start with survival responses. When we experience those losses, the trauma, the stress, the chronic stress, right? When that stress level goes to the toxic level, it creates survival responses. And those responses are your fight, flight, freeze, fawn, and flock. And those are different ways that people respond. And oftentimes, the primary illustration of this is you're thinking, oh, fight is like attacking, running the fight back, and all of that, and flight and escaping. But what happens is our body is here, we are still here, but internally we're doing that fight, right? We're trying to escape, or we're freezing or shutting down. Freezing looks like withdrawing, isolating. Fawning looks like actually befriending the threat or befriending the danger instead of running away from it if it's necessary. Then flock is actually bonding with other people based on those who are responding the same way, or based on, something, some kind of affinity, just bonding with those people so that we can deal with or cope with what happened to us. And where the actual issue comes or the challenge comes is that response that we have, those automatic responses, those survival responses, they don't turn up after the threat is past, but it continues. And that's what might create a disorder. So what is the difference between physical illness and mental illness? It shows up, they both show up in your body, but specifically, mental health issues will attack your thoughts, your emotions, your behaviors. And when I talk about behaviors, I mean your work performance, your productivity, and your relationships, your social connections. So your behavior also includes your relationship with your creator, with your higher power, because that's another connection that people rely on also when they have these negative experiences, right? So it can impact the whole person, the whole being. All right. So that leads us to those common diagnoses that like mental health professionals might discover after doing an assessment. We're talking the anxiety, the depression, schizophrenia, obsessive compulsive disorders, PTSD, addiction, ADHD, Alzheimer's, suicidal thoughts, all those different diagnoses. So just to give you a little bit more here, when we talked about the mental health issues or the symptoms showing up in your behaviors, in your thoughts, in your thoughts, your behaviors, and if I remember the word, it will come back. So when we talk about this, for example, addiction will show up in your behaviors. It will show up in your social connections, because at some point, people start acting out, or, what's on the inside, start coming out on the inside and impacts relationship. It will impact work performance, or functioning. In particular, the person being able to take care of themselves. PTSD will show up in people's thoughts, people's feeling of safety in their emotions, right? ADHD is attention deficit hyperactivity disorder. That will definitely impact someone's motivation, someone's ability to focus, and just being able to perform, be productive in their work, etc. Alzheimer's is more of a memory type issue. It will show up in the person's thought, of course, and just their behaviors as a result also, memory loss, etc. And I'm not going to go too deeply into this because it's not about people diagnosing themselves, but actually going to seek help when they sense that something is attacking those, or those that they are seeing those symptoms in their thoughts, in their emotions, and in their behaviors. And of course, we also need to talk about suicide, because by the time someone, that survival response has failed so long that people are thinking about not being part of this world anymore, they are already in pretty advanced, severe mental illness and definitely need immediate help. Okay. So let's talk a little bit about levels of impairment. That's the some of the terms to differentiate the different levels that people might be at. And one reason why I brought this here today, not to be too technical, is that people want to know, okay, when can I still manage this by myself and when do I need help? Right? So I like to illustrate it with this diagram on the left, where there is your stress, right? Daily stressors. Then there is this stress where the pot start boiling over, but yeah, you can kind of still manage. And then there is disorder where the pot has boiled over so much, it's about to burn itself and explode. So that's definitely, by the time we're in distress, it's important to start asking for help. So let's say if we classify it into different levels, let's say for the sake of understanding that level 1 would be your daily stressors that would affect your mood, your motivation, your sleep, your appetite, but the person is still functioning. Then what do the person need? What does that person need at level 1? They might need some self-care. They might need to learn some coping mechanisms. They might benefit from psychoeducation, from understanding what is happening to them, understanding their thoughts, understanding their emotions, being able to put words to their emotions, and understanding, being able to observe their behaviors and all of that. Or, making lifestyle changes like exercising, eating food that helps support them, etc. Right? Then at level 2, let's call it moderate distress, the person might need all of level 1 interventions, but also their functioning is starting to reduce. They're less productive. They have more conflict in their lives. They might start to isolate and withdraw. So what they might need there is all of level 1, some therapy and support from other people and from professionals. So level 3 would be severe distress, right? Then the person might need all of level 1 and 2, because then their functioning is already impaired. And if that wasn't clear, functioning will go back to how is their behavior, how their work productivity, their work performance, and also their relationships. How are they interacting with other people? So that's part of their function. How are they taking care of themselves, their personal care, and all of that. So you might see that with severe distress or severe um, and yeah, with severe distress, the person might start lacking personal care and is creating a major disruption in their life and starting to affect other people. Then that person might need therapy and medication. Then at level 4 is severe mental illness, or when someone is in crisis. In that At that level, the person is already incapacitated. They need supervision. They might be suicidal and or feel disconnected from reality, which is usually the case when it comes to schizophrenia. Then level 3 in no, so at level 4, what they might need is level 3 intervention plus hospitalization, intensive treatment, and family intervention. So I wanted to pause here and really talk a little bit more about family intervention, because as you can see, what someone might need at level 1, they're still coping themselves, they're still handling it. But as you go down or up the levels more and more, they need more and more support. And at level 4, someone else might need to say, hey, you're not doing well. We need to get you some help. And it's also very important because sometimes people can see or they are not aware. They're not self-aware enough to see those changes, right? Or to understand that their behavior is starting to impact others. So that's where being able to have those conversations really matter. Okay, so when it comes to, again, the needs that we may have at different levels of distress, it's important to note that humans are not one-dimensional. It's not just our body, right? Or we're not just like this person, like a blob of of flesh just going around, moving around in life. There's so much that comes into that makes the person with your body, mind, and spirit. And depending on what discipline you're from, or what background you're from, the roles that you play in your different life, we tend to play multiple roles at the same time. So when it comes to self-care, for example, and in the mental health community, a lot of people talk about wellness having at least 8 dimensions, which are your physical, which is your body, your physical health, right? Your emotional health, your spiritual health, intellectual health, your environmental health, because it could also be the place where the person finds themselves that is creating the disorder, their occupational health, like their work performance. And that's why a lot of people also are advocating for employers to start considering, to start making provision for people's mental health in the workplace. I'm sure you all can, at least someone can testify of working in a toxic environment and that affecting your mental health as well. And then your financial and social dimension as well. So as we're talking about self-care, for example, for level 1, self-care might involve working a little bit on all these different areas of well-being. And this is why when people, even when people start understanding what mental health is, they're like, oh, maybe this is a spiritual thing. And it just might be, right? And at the same time, because we are multidimensional, it might not just be that. So finding a solution should also be multidimensional and cater to the whole person, the whole being, to your body, your mind, and spirit. Because as one part of you is doing better or doing well, the other parts will be doing better and doing well as well. Because even as people, we are living systems, right? So you want to take care of your whole system. And I've heard of a lot of people, having there's people who have church trauma even that start affecting their whole life, right? Spiritual trauma is something that can also affect your whole being and even your relationship with God. So that's something to also, and that starts with your mind, right? But then it starts affecting your spirit. So all those things can be vice versa and affect each other. That's why taking care of yourself is a whole person thing and needs to be addressed in multiple areas. Okay, so that brings us to a question. Why do we struggle with asking for help? I'm going to pause right here and hear from the audience.
I'll say fear. Fear of being, fear of exposing that, like, because asking for help means I have to tell you something is wrong with me or something is a problem. And there's that fear, whether it's fear of judgment or fear that you might not understand what I'm going through. And now I'm telling you stuff and you're looking at me like I'm crazy, so I don't want that. So that can be, but I think there's a lot of just that fear of one judgment, again, because of the perception of this thing. Somebody comes and says, this is what I'm dealing with, these issues, and the first thought is that's crazy. So I think fear is one of the reasons when people realize you have to, it's almost like if you don't have somebody you genuinely trust to share these things with, you rather keep it to yourself than talk about this. You talked about the church, the spiritual trauma. A lot of people have been vulnerable before, and it was used against them, and so I don't want to go through that again, and so they hold back.
Yeah, no, those are some very good points. The vulnerability that was not honored in the past, and just the fear of being misunderstood or being labeled as something. So, yeah, those are very valid concerns. And this is the reason why we're here having this conversation, because one of the points I really wanted to get across is that at some point we'll all struggle one way or another, because no one is exempt from those things that we talked about in the beginning, right? And it happens to all of us. And you would think that as people we will get better at understanding and supporting each other, but this is as we're having these conversations, my hope is that when we are able to see those things in ourselves and have compassion for ourselves, we're better able to extend that to other people when they come to us with those uncomfortable things. Because we have to be honest, they are uncomfortable for people to hear, right? And a lot of times people don't know how to deal, they don't know how to respond. And they respond with those survival responses, right? Because when you see pain and struggle, sometimes it connects with your own in a way that's not pleasant. So then uh, we tend to respond in not so helpful ways. Mhm. Anyone else?
I think sometimes people are afraid of being a burden to other people.
Yes, that's a good one. I've heard that before also. Okay. Anyone else? Okay. And that brings us to the next one. And these are just my thoughts, but you guys also brought up the same point. The culture of silence, because again, that goes, that's that's the underlying reason for why we don't want to burden other people, or the fact that we think if we say something, we're complaining or we're being ungrateful, right? Especially as immigrants, we think, oh, we should be happy and glad that we're here, that we're not where we used to be and all of that. But it doesn't mean that we're not, that struggle will never happen again, right?
Yeah.
So, yeah, and even just the way we're raised, and you're not supposed to talk back. You're not supposed to say, then just going, moving on to the next one, avoiding that emotional vulnerability because we just don't know how to deal with it. Like we don't know how to handle struggle, or how to see someone else struggling and respond appropriately. And just that fear that the person will not understand and all of that. And sometimes it's denial. Sometimes we're thinking, oh, it's something else, because we're more comfortable with that, it being something else. And usually that's where we talk about, we think it's a spiritual thing, because then we know how to respond if it's spiritual. But if it's something else, we might feel powerless to address it. So it's easier to deny what it is, what we're seeing, and to kind of start arranging our lives around the thing instead of addressing it directly. And Dr. Nandi also talked about poor communication because some people, when you tell them, it's straight to the judgment, straight to the label, straight to the that's crazy, right? And that's poor communication because there's no understanding there. There's no solution there. It's kind of like, if it's something is labeled as crazy, then where do we go from here? There's no hope in that. There is no way to fix that, quote unquote, right? So we're afraid of being labeled as something. And I think even within families, the hardest part is that we haven't learned accountability without shame. We haven't learned to hold, different emotions and know that it's part of the person, right? That everyone has emotions. And when we want to say that something is wrong, it's straight to things, it's straight to name calling, straight to harsh language and all of that, because there's just something that we are not used to or didn't grow up with. And there are many more reasons. Is there anything that I forgot that anyone wants to bring up? Okay. Moving on. So that brings us to how to ask for help or get support. And we need to first, especially when there is a crisis, do not hesitate to call 988, which is the suicide hotline, but they can also connect people to different resources that can do that immediate response. And when there is a situation where there's an immediate danger or threat, going to emergency services, to the emergency room, or calling 911 would be your first line of defense. But then when the person is still stable at level 1, level 2, and can still look for help for themselves, the go-to resource would be Psychology Today, where they can look up and find their own counselors. Open Path Collective is another one. The Loveland Foundation is another one. And these two are nonprofit organizations. So they have either free sessions or sliding scale, low cost sessions for people, at different income levels. Then there's also support groups. There are some great support groups out there. And here, especially for when it comes to asking for support, there is a lot of resources available, but they're also organized in a particular way. One being by state, another one being by like level of specialty and all of that. But it's important to first recognize for yourself, to build that self-awareness of what am I struggling with? What is it impacting? And I hope today's presentation helps at least, start getting some clarity as to what that is, so that as you're looking for that psychologist or as you're looking for that counselor, you're able to say, okay, this person deals with family of origin issues, deals with ADHD, deals with addiction, etc. So this is the person that I need to connect with in order to get some support. Because I understand it can get overwhelming to do that research and to find the right person. And in the profession, we also talk about that it's kind of like dating. You might need to try different ones in order to find the right match for you. But then I personally believe that even just taking action to seek for help is important, and you're going to benefit from the action that you take, even if that's not like the final person that is meant to help you. All right. Then people can always seek a mental health evaluation. There is a resource I came across recently called the Sylvia Brafman Mental Health Center, and they offer free or low-cost mental health evaluations, especially when it comes to that level 3 and up. If you feel like there is something that is definitely an impairment or going in that direction, you want to seek out a mental health evaluation. And that would also remove the guesswork where, you're supposed to, the guesswork where you don't have to, just go from your own assessment, but be able to receive personal support, even if just at a preliminary level. Because when someone goes to the emergency room or the suicide hotline is called, it's that evaluation that the professional helpers will do as well. So you can request an evaluation voluntarily as well. And then asking your PCP for a referral, I think that's something we don't talk about enough, because most PCPs will have some resources to share with you. And if you're able to share a little bit, usually your PCP is someone that you trust, that you've worked with for a while. And if you have that level of comfort and trust with them, you can tell them what's happening. Because sometimes people come and they haven't told anybody. But if at least you trust your doctor, the PCP might be able to make a referral, or at least do a preliminary assessment also, and then tell you if there is concerns or not and be able to refer you to some additional support. And then there's also university-based clinics. I believe Georgia State has one, Emory also has one. And those, they may be, Mercer as well, also has a university-based clinic. And they may be university-based, but they serve the community at a lower cost. And if you're looking for like some therapists in Georgia, I've heard great things, good recommendations from Eagles Landing Christian Counseling for people who want to connect with a counselor that also has a Christian background and can direct them in that way. And it's important to know that don't be discouraged, if you don't find exactly the counselor that has the same background or the same demographics as you, because they may not take you all the way, but the counselors with good training will be able to at least get you to the basics, which most counselors start with. What are your thoughts saying? What are your emotions saying? Which is usually the two out of the three in the behaviors, right? Those three main things that where the symptoms show up. So most trained counselors will be able to get you there, and then there is definitely, once you got that foundation, that foundational understanding for yourself, you yourself will be able to better choose somebody else that aligns better with time. Then there is the community service boards. There is actually county-based hospitals, behavioral health organizations that offer mental health services for the community. In Georgia, some of them are called, one of them is called Claritel. I think they moved from DeKalb Community Service Boards to Claritel, but when you type community service boards, you will find the nearest one near you. It's pretty much, the behavioral health or mental health hospital near you. All right, that brings us to the end. And is there any additional questions?
I have one. So I was thinking about this just now. How we do our annual physicals, and you don't have to be sick to do that. It's something that's required. From a mental, health perspective, what will maintenance look like, or what should that look like? Where, because I'm thinking about it now. It's not something that's on the menu per se when I go for annual physicals. I'm like, how we're making sure you check all the vitals and things, how we're making sure that this other side of it is, the mental side is good as well. What kind of maintenance things do we need to be going through regularly to make sure that we are, we're tracking properly and not waiting until symptoms might not be obvious from the start, and yeah.
Exactly. That's a great question. I would say that I'm thinking that most physicians, when you go to your PCP, some of the questions that they ask you are also mental health related, because more and more the mental health profession in general is understanding that those things are linked. So they do those assessments. I think it's also a matter of, everyone being more clear and transparent as to, okay, we have concerns, which leads to more assessment or not. But I think in general, those things are done. And I would say self-care is important, like we said, because most people will be at level 1 at different times of their lives with daily stressors, right? So self-care and is that maintenance to do in different areas, and being able to check in with yourself, building that self-awareness to pause and say, Okay, how am I doing lately? I feel like I've been more irritable lately. I've been a little bit more snappy with my family, or, I haven't been eating well these past couple of days, and I feel like I'm more irritable and all of that. So I think maintenance also comes down to building self-awareness. And sometimes we can do that on our own. But if it feels like, we're always constantly in survival mode and not even feeling like we can pause and check in with ourselves, that's already an indication that we're going down a path where symptoms can come up. So I think it's being able to self monitor is the first step to maintenance, and that starts with that self awareness.
Thank you.
Mm-hmm. Any other questions?
I want to say thank you for the resources you put at the end. Because again, that's something I would say most people sometimes might struggle with. Like, if I go there, is it going to be used against me? Are there any, like, maybe, is it like the law, privacy where it says, whatever you say to your lawyers, keep with your lawyers? Is that the same thing that works in places like that too?
Mm-hmm. That's a good question. So when it comes to mental health services, you will note that some workplaces even offer through your EAP, you might have, I don't know, 6 sessions for mental health and all of that. And they're already paying for it. So that's a good way to even just try to see, how you're how you're doing with your mental health. And from my experience, and don't quote me on this because people can do whatever and break the rules, but there is definitely counselor client privileges. There is privacy and confidentiality clauses that come with the profession. And once you get in contact with a counselor, even if it's through your EAP at work, they have that patient client confidentiality. You sign an informed consent that would say that they do not share your information with anyone. The only exceptions is if you are planning to hurt yourself, planning to hurt a child, or reveal that you're hurting a child or an elderly person. So those are the confidentiality clauses. So your employer cannot use or ask for the therapy notes, for example. the There, it could be that your counselor, if there's like a lawsuit or like a criminal case, that's different, of course. But then basically no one can access those records of what you talk about. And if they're providing your EAP and you're still employed there, if you start the services, you already know they're not. No one fires people for seeking counseling or for seeking services, and that is probably grounds for a lawsuit if they do, because they're supposed to be supporting their employees' mental health. And like I mentioned before, like workplaces are getting more and more aware of the necessity to provide that support. And when it comes to, I think it also goes back to just, that fear, right, of being labeled and overcoming that fear for yourself, because once there's also that fear of appearing weak if we're seeking help and all of that. But this is just the overall thoughts that come to mind. But for more specific, I could probably answer, I may answer differently if there is like a more specific concern about that in particular. But I would say that, it, like, technically there is patient client privileges that prevent any counselor to share your information with anyone directly, if that's the concern. Mm-hmm. Any other questions, thoughts, or concerns? All right. Thank you all so much for being an attentive audience.
Thank you so much. Very
Thank
helpful.
you.
All right. And I'm just going to scroll to the AIM announcement. Feel free to stay connected with the AIM community and to ask more questions there. And yeah, if you have a specific situation and you want the that you think the AIM community can support with, or you want to reach out to me directly about seeking support for someone, because I think that's also something that we struggle with, where it's like, okay, who do I call? Who do I ask for help? So just from knowing Stella and Dr. Nandi, they are very in tune, with those things, and they will be able to reach out to me as well if someone needs a recommendation. But the most important thing is not to isolate and not to be alone or feel alone when these things happen, because it can happen to anyone and it can affect not just the individual, but the whole family and indirectly your community as well. So, yes, please reach out if you need any support. Thank you.
Thank you very much, Letitia. And how can they reach you if they need to? Do you have your LinkedIn or something?
Yeah, so my LinkedIn is not on there, but my LinkedIn is Leticia Toplo. You can definitely reach out to me there, or in the AIM community. I am part of a lot of the AIM groups. So feel free to shoot me a message, or just, if you have Stella's contact and you want to ask her privately, you can reach out to me that way as well.
All right, awesome. Well, thank you again for sharing, for always being generous with your time and expertise. We're definitely blessed to have you as part of the AIM family, as part of the AIM community. Again, you shared some of the announcements. Today was the beginning of our Business Igniter program. It kicked off very well with the Gwinnett Chamber Foundation. It was a successful kickoff, and we're excited about just where that is going. We plan to announce, it will still open it up for people who still want to join, because today was really good. We figured, more people need to hear this, and so it was a good first start to the event. It's our first Catalyst program that we've ever run, and it's off to a great start. So we are excited about that. The Advocacy and Policy Conference is happening June 27th. So that will also be the graduation event for people who are going through the Business Igniter program. But then it's our second flagship event of the year, so we're excited about that one. It will be happening, for those who are local here in Atlanta, at the Gwinnett Chamber of Commerce office, the Gwinnett Chamber Foundation office in Sugarloaf area. So we look forward to having that, and all the people completing the program will get to showcase their businesses and what they're about. But we also get to hear from elected officials, and just in the climate that we live in today, it's important to be attuned with what's happening in government and all our civic obligations. So that's what that will be about. So we're looking forward to that, and everybody is welcome to find ways. This AIM is always looking for people to get plugged in, whether you want to be a knowledge partner like Letitia and share your expertise, or you want to volunteer in other areas. We have a ton of opportunities, so we encourage everybody to come on board and find where fit in, where where it works for you, where your skill sets are, and let's keep our AIM is a community of givers. We just come together and serve. There's a platform for you within the community, and of course you can donate as well. We are a non-profit, a 501c3, so every donation is tax deductible. So we welcome donations. We are specifically pushing for recurring donors, so we can at least have a predictable predictable runway for how we operate. We want to know, okay, this is what we're expecting every month. So your $10 a month, $20 a month, $1,000 a month. It helps us, facilitate the work that we're doing. So thank you all so much again. The replay of this will go live by Tuesday in the community. So make sure you share with somebody who needs to go over this, where who might benefit from this when the replay goes live. But that said, I will let us have back the rest of our Saturday. Thank you all again. We are here every Saturday by 2 p.m. Eastern Time. So next week is going to be another incredible session. I think next week we're not having the master classes. We are having an information session for the community. It's going to be an open, just letting people know who we are, what we do, and how they can get plugged in. So please, for everybody who hasn't plugged into all that we are with AIM, please get plugged in, and we'll love to see you next week Saturday. And then last but not the least, Monday, May 25th, AIM is going to be 2 years old. So 2 years of us just doing this work, and so we're doing a lot of things, but one of the things that we're asking for is for people to share their stories. And so if you have been impacted by AIM, maybe you met somebody in AIM and it's gone on to benefit you in one way, or you attended a session like this and you took something away. Whatever it is, you attended a conference, an event, however small it is, you feel like AIM has impacted you. You met somebody and they become a friend that you do, and that's it. We want to hear from the community too. That's what, want to validate our impact. So please reach out to us. I think we've been sharing the forms on WhatsApp to get feedback from people. But if you want to message me directly, message Stella directly, go ahead and do so. But we're collecting stories, and so please, we want to hear yours, and we want to build out this. That's what we can use to go to anybody and say, hey, this is our impact, and these are real people who have been a part of this community, and this is how it's impacted them. So please help us with those stories. That's the biggest thing we're asking for. So thank you all so much. Please enjoy the rest of your day, and we'll see you back here next Saturday for our information session. It's going to be at 3 p.m. 3 p.m. next week Saturday. So around this time next Saturday, it's going to be happening. So please, let's plan to be present. Thanks, everyone. Stella, you have something to say?
Awesome session, Leticia. Thank you.
Thank you again, Leticia.
That's
Yeah.
well, basically.
Yeah, thank you.